Okay, good evening, Miss Mitch. My name is Shayqua Mitchell. I'm going to be your provider for today. And today I'm going to be conducting a respiratory examination on you. Will that be okay?
That'll be okay.
Okay, I've already washed my hands. I'm going to go ahead and sanitize them. Okay. Now that I've sanitized my hands, okay, the first part of the exam, I'm going to begin with inspection. And with that, I'll be taking a look at the skin. I'll be taking a look at her overall complexion, her color, looking for any signs or symptoms of poor gas exchange, poor blood flow to the skin, and for cyanosis and things like that. And also, for the purposes of the video and for privacy, the volunteer will keep her shirt on, but during a regular exam, we would remove the shirt for better observation. But during inspiration and expiration, I would be looking at the skin for things like symmetry of the chest cavity. I would look anteriorly and posteriorly. I would also be listening for any audible wheezing while the patient is breathing. I'd be assessing for any respiratory distress, any visible respiratory distress. I'd be checking for any use of accessory muscles, and I'll also check to ensure that the trachea is midline. So what I'm going to do now is I'm going to use a timer and assess her respirations. For purposes of the video, I will assess the respiratory rate for 15 seconds and multiply by 4 in a regular setting. As long as the respiratory rate is normal, you can do a multiplier of 15 seconds by 4 or 30 seconds by 2. If not, you would assess the respiratory rate for 60 seconds. Okay, so now I'm going to begin assessment of respirations. Okay, and for respirations, I got 16. Okay, and for her respirations, I did 4 times 4, and I got a rate of 16. And also, her respiratory rate was normal. The depth was normal. She did not appear to have any labored breathing or use any accessory muscles with the work of breathing. So the next part of the exam will be palpation. And what I'm going to do, I'm going to begin to feel for any tenderness in the anterior and posterior chest wall. So I'll begin by touching here. Any tenderness here? Okay. Any tenderness here? Mm-mm. Any tenderness here? Any tenderness here? Mm-mm. Okay. Can you turn your back to me? Any tenderness here? How about here? No. How about here? No. How about here? Okay. Okay. Also, I'm going to palpate the lateral chest for tenderness. Any tenderness here? About here? 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 Okay. Okay. Next part of the exam, I'm going to test respiratory excursion and expansion. I will begin anteriorly. Can you turn facing me, please? What I'm going to do, I'm going to place my hands here and bring them in. Now I want you to take a deep breath in and out. Okay, again. Okay. And now could you turn your back facing me? Now we'll do posterior. Turn all the way facing me. Okay. Show on the camera here. Okay. Can you give me a deep breath in and out? Again. Okay. And while I'm doing that, I should be watching for symmetrical rise of both hands. And that is indicative of things like lung capacity and how much the lungs are expanding. And while I have the patient turned to me, I'm going to next assess tactile fremitus. And tactile fremitus is something that assesses the density of the lungs. And so posterior, I'm going to assess 4 locations, and then anterior, I'll assess 3 locations, at least 4 locations and at least 3 locations. So I'm going to start with the ulnar surface of my hand and make sure I go in between um inter uh intercostal spaces. Okay. Can you say 99? 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. Okay. Can you turn facing me? Okay. Okay. 99. 99. 99. 99. 99. 99. 99. 99. Okay. Next, I'm going to assess diaphragmatic excursion. And what I would do is I would measure, I would estimate the placement of the diaphragm, the position of the diaphragm when my patient takes a breath in and out. So first, we're going to begin. I'm going to ask my patient, I want you to take a deep breath in and out and hold it on expiration. My first one can go right here. Okay. And now I'm going to ask you to inhale and hold it. And now I'm going to measure the distance in between. You can exhale. I'm sorry. Now I'm going to measure the distance in between those two markings. And the distance here is showing about 4 centimeters. And the norm should be between 3 to 5.5 centimeters in distance. Okay, next I will continue with percussion. Percussion. I'm going to percuss for at least 7 spots posteriorly, and then I'll do at least 6 locations anteriorly, and making sure not to strike over any bony prominences. Okay, you turn facing me. You get the right location here. Okay. 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 The final part of my exam will be auscultation. And with this, I'm going to be listening for any adventitious long sounds such as rails, ronchi, wheezing, any crackles. Um, During the auscultation, what I should expect to hear would be vesicular breath sounds, which are considered normal breath sounds. And for this part, I'm going to listen anteriorly in 6 locations and posteriorly in 7 locations. And now we'll be listening with the diaphragm of my stethoscope. Okay, deep breath, mouth open. Okay, again, again, okay, again, again, okay. Her breath sounds anteriorly are all normal. You turn facing me now, and I will assess the posterior chest. Okay, deep breath in and out. Okay, again, 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 one more time, again, again, sorry. Do it one more time, again. Okay. Part of my exam, I'm going to be testing for egophony, bronchophony, and whisper pectoriloquy. Okay, with egophony, um, I'm going to ask the patient while I listen with my stethoscope to make a E sound and hold it. And if it sounds something like A, that could be indicative of abnormal lung consolidation. With uh, bronchophony, I'll ask the patient to say football, and if it sounds loud and clear, then that's abnormal because it should be muffled. And with whisper pectoriloquy, Also, I'm going to ask the patient to say 99, and if it sounds loud and clear, that would also be abnormal. And again, with testing for these three things, that would be indication of abnormal lung consolidation or another or other underlying conditions. So first, I would do egophony. Okay, I want you to say E and hold it. E again. E again. E again. E again. E. Sorry. Again. E. Okay. Again. Okay. Bronchophony. Can you say football? Football. 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 Okay. And the last one I would do is the whisper pectoriloquy. Okay, can you say 99? 99. Yeah. 99. Yeah. 99. Again. 99. Yeah. 99. Okay. 99. Okay. Okay, you can turn my facing me. And throughout the course of the exam, I did not observe or notice any abnormalities with her breathing, with her breath sounds, no labored breathing or anything like that. Did you have any discomfort, any concerns? No. Okay. That will conclude my exam for today.